Hi, I'm Dr. James Donovan, and in this video we're going to cover key things that I think you need to know about acne, which looks like this. By the end of this video, you should have a better understanding of what acne is, what causes it, what it looks like, with some real-life photos on different skin types, how it can be treated, and finally 8 tips that you can do to try better manage your acne at home. So first of all, what is acne? Well, acne is a very common skin condition where there are blackheads and whiteheads, which are medically known as comedones, and pus-filled spots, which are called pustules. Now, acne usually starts during puberty, but it can develop at any age, and it can range from a few spots on the face, neck, back, and chest to a more widespread and severe problem that might cause scarring and cause you to feel less confident. Now, while it tends to go away by the time people are in their 20s, it can persist longer or even begin in late adulthood. In terms of what causes acne, well, it's largely influenced by our sebaceous glands, which are the oil-producing glands of the skin which are affected by hormones. In people with acne, these glands are particularly sensitive to normal blood levels of hormones, causing them to produce too much oil. At the same time, the lining of the pores becomes thickened and dead skin cells are not shed properly. Now, this leads to blocked pores and the formation of blackheads and whiteheads. Now, the plug of dead skin turns black from the exposure to air, not because of dirt. Now, bacteria can also multiply in the buildup of oil, leading to inflammation and the formation of the red, swollen, or pus-filled spots, which are the things that we refer to as pustules, and these look like this. Now, it's also worth knowing that acne can sometimes be triggered by medications given for other health conditions, such as certain contraceptive injections or pills, and some hormone-containing tablets taken by bodybuilders. Additionally, some foods and stress can trigger or exacerbate acne, and this is again going to vary from person to person. So now we know more about what acne is, some potential underlying causes. Well, what does acne look and feel like? Well, acne typically appears as a combination of oily skin, blackheads, whiteheads, red spots, as well as pus-filled pimples. And here are some photos of what these look like. Now, if it's quite severe, then larger, deeper bumps, which are called nodules or cysts, may also develop, and the skin that is affected can feel hot, painful, and tender. Now, if you scratch or pick at the acne, it can leave scars or marks, which might be raised, indented, or discoloured. And so, whilst it may be really irritating or annoying, please do try to avoid picking or scratching at it. Now, in terms of treatment, acne treatments fall into several different categories. And whilst I'll make a more detailed video on acne treatment options later on, this is intended to give you a broad overview of the different types of treatments, as well as some examples of each of them. Now, the first thing that we're going to talk about are things called topical treatments. These are applied directly to the skin, and they're usually the first choice for mild to moderate acne. And they can come as gels, lotions, or creams. They include benzoyl peroxide, antibiotics including erythromycin, tetracycline, or clindamycin, as well as medications called retinoids. So these are things like tretinoin, isotretinoin, or adapalene. Now, it's important to apply these treatments to the entire affected area, not just individual spots, and to make sure that the treatment is suitable for you, it's really important to speak with your doctor or pharmacist first, and always follow the instructions that come with the medication. Now, the next broad treatment category are oral antibiotics. Your doctor might prescribe antibiotics like erythromycin or tetracycline, and these are often combined with topical treatments. Courses of antibiotics for acne typically last for 3 to 6 months, so it is typically a fairly long course of antibiotics that you're going to be taking. Now, some contraceptive pills containing hormone blockers can help to reduce oil production in females, and these can be a potential treatment option. So if you are a female, it's worth discussing these if this is going to be an option for you with your doctor to make sure that they could be appropriate. A medication called isotretinoin is also a powerful treatment for severe or persistent acne, but it can cause serious side effects, and it must be prescribed by a specialist skin doctor called a dermatologist. Sometimes, despite your own doctor trying to treat your acne, it might be necessary to refer you to the specialist skin doctor, especially if you've got a large number of papules and pustules on your chest and back, as well as on your face, and also if you've got painful nodules. It's also important that you get a referral if you've got scarring or you're at risk of scarring, or if your condition is making you very low or anxious. Finally, here are 8 things that you can do to try help manage your acne safely at home. So first of all, I would suggest avoid picking or squeezing spots to prevent scarring and infection. Secondly, seek support if the acne is affecting your self-confidence or causing distress. Consult your doctor if acne makes you feel depressed or anxious. I'd also suggest use over-the-counter treatments for mild acne, and speaking to your pharmacist can be a really helpful option if you feel that it's not severe enough to see a doctor. And try to be patient with treatments. Improvement usually takes at least 2 months to happen. I'd also recommend that you cleanse your skin gently using a gentle skin cleanser, which your pharmacist again can advise you on, and avoid scrubbing too hard or over cleaning the skin, because this can again cause irritation. I'd also suggest that you monitor your diet for high glycemic index foods, so things that are really sugary or dairy that might trigger breakouts, but consult your doctor before making any significant changes to your diet. Now, for more detailed information and additional resources, please check out the description box of the video. Please remember that this video is designed to give you a general educational overview, and I'd always suggest that you consult your own health provider for personalised advice and treatment options. Thanks for watching, and until next time, bye.